Today on the Dennis Michael Lynch podcast, Dr. Peter McCullough joins me. We're going to be talking about COVID, and we're going to talk about some very interesting initiatives that he has put forward. And if you're somebody who had the jab, you're going to want to listen. So get ready, because it's all unfiltered.
Dennis Michael Lynch gives you his word, and he will never let you down. He will always fight for America.
The only one who really puts his money where his mouth is Dennis Michael Lynch.
Hello, I'm Dennis Michael Lynch, and I thank you for joining me today. Today I have a very special guest. He's been on the show about 4 or 5 times. Every time he's on, my inbox is just loaded with more questions like, when are you going to have him on again? I'm like, I just had him. And then everybody always says, well, you didn't ask him this, you didn't ask him that. All right. Well, it turns out to be that I spoke to him yesterday on a separate matter, and he was telling about some interesting things he's got. I said, you got to come on the show. He said, all right, I'll do tomorrow. So this is a man who is working around the clock to try to make it so this way Americans can be healthy. He is so upset with what's gone on with these shots. Dr. Peter McCullough is here with us. Doc, before we get into your actual initiative and where you explain what it is you're doing for people who have already had the jab, I thought it would be interesting if I just gave you 3 things that if you did the Google search COVID, if you did a COVID Google search, some of the things that would come up right away, I've narrowed them down. I want to get your take on this. Number 1, CNN. Here's the title. COVID shots may slightly increase risk of stroke in older adults, particularly when administered with certain flu vaccines. Number 2, this is just today on the New York Times. It's COVID season. What are the new rules for staying safe? Right here at the top. You've heard it before. You'll hear it again. Masks can help you protect yourself and others from becoming sick. So can washing your hands thoroughly and not touching your face with unwashed hands. And the updated COVID vaccines can also reduce your chances of being infected and especially cut down on your risk of serious illness. This is from the New York Times. This is from CNN. What say you, Doc?
It's a mixed review. Let's take them one by one. The first one about a slight excess risk of stroke, that's the understatement of the medical century. What we know is that the vaccines markedly increase the risk of stroke. A paper by Von Dag-Berhild, published in JAMA 2022, reported on 7,750 disabling strokes and intracranial hemorrhages after Pfizer, Moderna, or AstraZeneca within 28 days of taking the shots. That was from 3 Nordic countries, and they carefully ruled out the infection. So I can tell you, when I see a patient with stroke, the first thing I ask is, what vaccine do they take and when do they take it?
Now, part of the whole COVID story is that there's always going to be a new variant, right? It's not like it's not like Hamas. Well, we go and we wipe out Hamas, the problem's gone, right? It's not like that at all. It feels as if it's catch a mole. Put your hand on this one and then another one pops up. When, right now we're in October, we're heading into, flu season, COVID season, according to the New York Times. The New York Times is saying here about how to keep yourself safe. Wear a mask, wash your hands, take the updated COVID vaccines. Is that something that you agree with?
This is what we know right now. AP Press and Reuters, as of October 4th, 2023, is reporting only 1.3% of Americans are taking the XBB 1.5 booster. And the reason being is that the vaccines have not been made any more safe. The booster was only tested on 10 rodents. There's no human studies whether or not it works. And we know now the outbreak, which is really led by EG5, FL 1.5, and HB, it's a very diverse outbreak, and it's already on the way down. So, this little fall spurt that we had late August, early September is already on the way down. Even people testing positive for other reasons, in the hospital for other reasons is on the way down. I haven't had anybody in the hospital The mild cases we're seeing, we're using virucidal nasal sprays and gargles. It's fine. I think washing your hands is fine. Masks, the CDC says we only need to wear masks if we're a healthcare provider and we're taking care of a patient in respiratory isolation, as we always would. I wear a mask in the operating room, cath lab, respiratory isolation. So even the CDC says that we don't need to wear a mask elsewhere. And in a Cochrane review, over 80 studies of public masking, it doesn't work.
You know, you just you brought up the CDC. I subscribe to your newsletter, and I think it was just this morning, if I'm not mistaken, you did a whole essay about somebody at the CDC actually doing a photo op of taking a booster shot, if I'm not mistaken. Is that correct?
It's true. You know, we wrote about Mandy Cohen, the new CDC director, who's a very underaccomplished physician. And she's already been on TV saying that her and her children took the shot. They're obviously in the 1.3% of people who did. She's oblivious to the record numbers of injuries, disabilities, and deaths that have happened with the vaccine. Now, even the CDC keeps its own record, the VAERS, the Vaccine Event Reporting System. Now, it's a gross underreport of what's going on. But if we toggle over to Americans, the CDC is telling us 18,000 Americans have died after taking the shot. And people who reported are doctors, nurses, paramedics, healthcare workers. That's like me. I did a VAERS report this week. Now, we know from that 18,000, over 1,100 have died on the first day they take the shot. The very day they die in the vaccine center, or they die a few hours afterwards. I mean, that is an outrage. Pfizer knew about 1,223 deaths alone in 2020, early 2021 with their shot in their post-marketing data. These should have been shut down when we got to 5, 10, 15, no more than 50 deaths. We now have a recent paper in the fully peer-reviewed literature by Michaels and colleagues showing that Pfizer knew about 38 additional deaths from the time they closed their data report in mid-November 2020 to the time of the December 10th, 2020 Vaccine and Biological Products Group review meeting. And if Pfizer would have disclosed those deaths, or the panelists would have asked for it, those deaths disproportionately landed in Pfizer patients. And so there was actually a 3-fold increased cardiovascular risk of death with Pfizer at the time of the FDA meeting. The products never should have been approved or even used in a single American.
You know, I've asked you this, as I said in the intro, you know, you've been on the show a bunch of different times, and I appreciate that. You know, you're always giving your time up. In fact, before we even hit the record button, you were saying, I try to do as many of these as I possibly can. And I got to imagine it's because you feel it is very important to get the word out. And I definitely appreciate that. I've asked you this question before. You've given me the answer. I'm going to ask you again, hoping that maybe there's a different answer, that, you know, maybe you've learned more since the last time you were on here 4 months ago. If we know that this vaccine and all the vaccines here are not working, they're not effective, and that they are indeed causing vaccine injury and as you've just pointed out, vaccine death, why in heaven's name does the CDC and the FDA and the White House, why do they keep on, the New York Times, I just read it to you, that's from today, why do they keep on pushing this damn thing?
It cannot be explained. You know, there's not a single country that's pulled them off the market. I've recently testified in the Arizona Senate for the Novel Coronavirus Southwestern Intergovernmental Committee, chaired by nurse and Senator Janae Shamp and businessman T.J. Shope. So we have Republicans, we have Democrats, senators, congressmen. And, you know, I told them, listen, if the federal government is not going to pull these off the market, if the FDA is not going to, you know, basically make the call, states should make the call. This is a consumer product safety issue. States should make the call that the vaccines are not safe for human use. Pull them off the market. You're supported by the World Council for Health, June 11th, 2023 pharmacovigilance report, which concluded that the vaccines are not safe for human use. They should be pulled off the market. The March 2023 public statement by Association of American Physicians and Surgeons, one of the oldest doctors groups in the country. It's been chartered since 1943. Pull them off the market. Now, I've called in the U.S. Senate December 7th, 2022, European Parliament September 13th, 2023. We're all agreed. And as I'm saying here on the DML, pull them off the market.
The thing, you would think that maybe the answer was money, right? Oh, there's so much money they're making so much money. Well, per your 1.3% of Americans, they can't be making a whole lot of money anymore in this stuff. It can't be about money. I mean, the FDA and the CDC, although, yes, I understand a lot of time the directors and the upper people, after they wind up giving away everything that they want to give away to Pfizer, they'll wind up getting a cushy job later on working for them. But this goes beyond money. I can't understand it. I mean, you got people like yourself. I mean, and, you're not the only one screaming. You may be the most known, but everybody's screaming about it. And we got the numbers. We've seen the deaths. We see the injuries. And they continue to lay it up there. And here you say that all these countries, not a single one has pulled it off the shelf. That means to me that something underlying. There's something underlying. There's something below the surface that we have not been able to scratch yet. I mean, I know this is speculation. I'm almost asking you the question the second time. If you had to say from your gut why you think it's still up there, why these things are still up there, what does your gut tell you?
I put it in my book, Dennis, The Courage to Face COVID-19. I think there's a biopharmaceutical complex, a very powerful syndicate that's formed. At the top is the World Health Organization, the UN. On the World Health Organization, one of the major advisors on multiple powerful panels is Anthony Fauci. We have the Rockefeller Foundation, the Wellcome Trust, the Gates Foundation. Gates Foundation, with the World Economic Forum, a very powerful entity, formed CEPI, the Coalition for Epidemic Preparedness and Innovation, a vaccine incubator. We've got Gavi, UNAID, UNAID, the Department of State. We have our Office of National Intelligence. It's headed up by a WEF operative, Avril Haines. The World Economic Forum has had a Young Globals Leaders program for years. They meet in Davos. They basically have infiltrated the major governments of westernized countries. And they're calling the shots right now. They are pushing this vaccine agenda. They will not stop. And they're so powerful that the companies cannot go against the biopharmaceutical complex. The Gates Foundation has a memorandum of understanding with the US FDA. This biopharmaceutical complex is spending more money than a lot of governments. They're big. And you know what? We called them out in our book, Courage to Face COVID-19, Preventing Hospitalizations and Deaths While Battling the Biopharmaceutical Complex. Dennis, you'll be astonished. This was a 5-star bestseller on Amazon for 18 months. It's also available at Barnes & Noble and, through the website. Book is incredibly popular. It was banned and pulled off of Amazon for bogus allegations of offensive content on September 29th, 2023. So basically our book joined Adolf Hitler and just a half a dozen books that are banned from Amazon. They said it had offensive content. It doesn't even have a single curse word in it. So we appealed 3 times. Amazon turned us down 3 times. Lots of public pressure in social media, a lot of phone calls behind the scenes. And then 12 days later, Amazon restored it and said they made a mistake. I have to tell you, I think behind this was pressure from the biopharmaceutical complex.
Hold on, I want to make sure I got this right. How long was your book out until you wound up getting the notification?
It was out 12 days.
12 days.
It was out 12 days. It was off the market. Why would Amazon pull it for a bogus reason, then stand behind it, and then ultimately succumb to pressure from the public to put it back up?
Wait. That's I think you got my question wrong. When did you launch the book?
Yeah. Oh, the book was launched in May of 2022. So it's been on the market 18 months.
Okay. So it's been on the market all that time. You said it's a 5-star review. You probably got tons of reviews. We know how your profile has just skyrocketed. And all of a sudden, out of nowhere, one day you get a letter from Amazon that says, we've removed your book for offensive content. Offensive, as in you used the N word, or you blamed a specific demographic. You said something bad about the illegal aliens coming into the... Nothing. You said nothing. Offensive content. So now there's a backlash on it. And then Amazon says, we made a mistake. And now it's back.
Amazon doesn't make these mistakes. They're in the business of selling books. So I immediately filed a Freedom of Information Act request to figure out which government entities or which members of this biopharmaceutical complex contacted Amazon to initiate this. I don't think this came from Amazon because they had no answers.
Of course it didn't come from Amazon. Of course it didn't. Welcome to the world we've been in for a very long time. I mean, I just got one the other day. I just got one from Facebook. Now, my videos, I've been hitting a lot on Biden and about Biden and stuff with Israel and his love affair with Iran. And, we monetize these videos on Facebook. Facebook invited me to do this because my live video is on Facebook, go so viral. And with that said, I wound up getting a notice just yesterday that no longer will my videos be monetized because I broke a community standard. I appealed it. So when you go to appeal it, it says that an appeal can take 2 to 3 days. I got something back in 2 minutes, which means that it was automatically generated. No excuse of what I did. No, doesn't say what I did. Just says I broke the community standards. What did I do wrong? So it's one of those things where somebody behind the curtain is pulling the string, and then when the pushback comes, they say, "Oh, we made a mistake," and now it goes. How disgusting! You brought up Anthony Fauci. I told you about how I did the search, Doc. This is today's news. Anthony Fauci to receive 2024 Inamori Ethics Prize from Case Western Reserve University. What did he do to get an ethics prize? So here's another, bought and paid for university, obviously. And this is what we're up against. And this is what you've been up against. And this is why you've been working so hard. I want to go into what you've launched now for people who've got the jab. But before we do that, yesterday, full disclosure, I donated to your organization, and I did so because I believe in what you're doing. And every time I speak to you, you are a book of knowledge. Can you explain to people about the 501c3 that you have launched and what it is that you're actually doing? You're going to do it better than I will. So go ahead.
Thank you so much. People have asked me for 4 years, Dr. McCullough, how can we help you? And, I took that to heart, and I founded McCullough Foundation, which is a 501c3. That means deductions are tax deductible. And it has 4 major areas of endeavor. The first has to do with, independent scholarship. That's generated the McCullough Protocol and now McCullough Protocol BSD, which we'll talk about. These have helped hundreds of millions of lives. Very, very important work. The second is work that deals with, the legal community. I'm an expert witness in over 100 cases pro bono. I pick up all my expenses, including travel time, depositions, etc. And I need help. There are people who help me with this, and they need to be paid. The third is a critical area in the media, like I'm doing right now. I have, so much media time, expenses. I'm in tens of thousands of videos, original presentations. I have the top doctor account on Twitter, a doctor who sees patients, and now it's banned for 2 months. There was a vote, and a vote on Twitter. Tens of thousands of people voted. 98-2 let Dr. McCullough back on Twitter. That was, towards the end of 2022, before Elon Musk came into power. And then the fourth area has to do with public policy. This is very important. I've testified 3 times in the U.S. Senate, European Parliament, just Arizona Senate last week. And I have to cover all my travel, hotel, etc. So McCullough Foundation, wonderful vehicle for a tax deductible donation. Thank you so much for your generosity. People have been very generous, and I'm prudent in doing this. But I have to tell you, as a public figure right now, I have the greatest academic standing of anybody who's opined on COVID-19. And I think it would be a dark place if it wasn't for people like me and other people in my circles.
Oh, listen, that's one of the reasons why I made the donation. And it's because, look, I'm one of those people that were blamed by Biden. I'm one of the unvaccinated, right? I was the reason why we had COVID. And I just never felt good about the way that it was processed and the way it was put through. And I did not like the emergency authorization that they had. And I just said, my family and I made a decision that said, we're not going to touch it. And, my daughter was saying this yesterday. She was saying, Dad, because she's going through a little medical issue. She says, thank God I'm not vaccinated, because if I was vaccinated, I would be thinking to myself every single day, that's why I have this ailment. And every time I went to a doctor, they would be blaming it maybe on the vaccine. She's like, no, we've got to stop this from going on. And then I think about what you just said, and you say it very humbly, but it should be blasted in caps. If we did not have somebody of your knowledge base who is the most documented cardiologist in the world, unless I have that mistaken, you are more published than anybody else. If we didn't have you out there pushing this, people wouldn't know what was going on. I mean, you have saved, I think, you are a hero in the sense that you have saved more lives than will ever be counted. There's somebody who is probably, I know this for certain, there is somebody who is listening to this program going back months, maybe a year ago, who is debating on getting that damn vaccine. And they listen to this show, and they listen to somebody like you who's very credible, knows what he's talking about. You start talking about myocarditis, you're talking about this, you're talking about that. And that person didn't get the shot. And that person is alive today. And if you really want to connect the dots and say maybe why they're alive, it's because they listened to you. If we didn't have you, what would it be? So I know that's why I give the donation. I'm from the bottom of my heart. Thank God we've got somebody like you. And,
thanks so much.
Let me hold on. Let me say one other thing too that you don't recognize. I think people have to recognize when this man asks for a donation because he's got to pay for things. I understand what he's talking about: travel and having a staff and doing all these media hits are taking so much time out of his day. He's a doctor. He makes his money by doing things in a doctor's office. And here he is. I'm not paying you to be here today. You're not getting paid by Fox or Newsmax or whatever. So that's why it's so important for people to donate to this man. Give the URL right now. So this way we get you some money today.
Well, thank you so much. So it's www.McCullough, McCullough, So McCullough, FND, Frank Nancy David.org. And then you click on it, you make a charitable donation, get your receipt right there for your taxes. But let me just respond to those comments. The McCullough protocol, which was the very first fully published, peer-reviewed protocol to treat patients early and prevent hospitalizations and deaths with COVID-19, became the AAPS, or Association of American Physicians and Surgeons, Home Treatment Guide Protocol in October of 2020. It's been credited with saving tens of millions and sparing hundreds of millions of hospitalizations, because early treatment is the only way to prevent a hospitalization. All the deaths occurred in the hospital. And now we've innovated with McCullough BSD, or base spike protein detoxification for people who've taken the vaccine. But this is in the context of Carrico and Weissman winning the Nobel Prize for pseudo-uridination of messenger RNA. It's just like the Fauci Ethics Award. Fauci received an ethics award while people are contemplating that, in fact, he's committed crimes, fraud and mass negligent homicide. He's being called up and in committees and reviewed by the House Oversight Committee. There are books written about crimes committed by Fauci. He receives an ethics award. Now Carrico and Weissman receive the Nobel Prize for basically making messenger RNA synthetic. You can't get it out of the human body, producing endless quantities of the spike protein, which has caused untold damage. A recent epidemiologic report by Dennis Rancourt from Montreal, an epidemiologist, very prominent, has concluded 17 million people have died from the vaccines, Dennis. 17 million.
Good God. With that being said, why don't we, because I have two other questions, I want to go back into something else, but why don't we talk right now about what it is, the new McCullough protocol, what you're doing right now for people who had already taken the jab and are concerned about that.
Mm-hmm.
What's your new initiative, and give it in detail and tell people where they could go.
What we know now is the spike protein from the jab is not broken down by human enzymes. Paper by Brogna and colleagues showed you can identify which spike protein is coming from the injections, by the way. It's got a proline signature on it. It's circulating in the bloodstream for at least 6 months, maybe longer, in the bloodstream. That's a foreign protein that was engineered in a Chinese biosecurity lab. That means people who have taken the shot are walking around with this protein circulating in their blood. This is an astonishing revelation. It can't be broken down. However, natural substances, enzymes taken orally can break it down. Japanese discovered nattokinase. Very importantly, it taken orally on an empty stomach, it gets into the system and breaks down the SARS-CoV-2 protein. It actually slices it up. Also, a family of enzymes in bromelain, which is a substance derived from the stems of pineapple. Bromelain is an FDA-approved drug as an ointment. It does break down various proteins, also anti-infective. And then curcumin, which has gone all the way through clinical trials in humans, does benefit long COVID post-vaccine injury syndrome, not because it breaks down the spike protein, but it actually helps manage inflammation and symptoms. So we put this together in a protocol. It's called McCullough Protocol BSD, Baked Spike Protein Detoxification. The doses are low and they can be advanced, but the doses are nattokinase 2,000 units twice a day, bromelain 500 milligrams once a day, both of those taken without food, and then curcumin 500 milligrams twice a day. This is on my website, petermcculloughmd.com, my clinical website. It's been published in the Journal of American Physicians and Surgeons. It's on the European Commission server, getting record downloads. This is the most widely used detoxification protocol. I've had direct observation now for about a year, showing great results. And now I've held a very wide invite call to the UK for doctors in the UK, and they're saying, again, it takes about 3 months, 6, 9 months, but patients do get better. Now, we add other drugs to it, but it's a good base. Anybody can do this. The caveats are bleeding, because this tends the body towards blood thinning, as well as soy allergy. If somebody has a soy allergy, can't take nattokinase. And again, the doses are low. We can advance them. I can't make any therapeutic claims because there are no large prospective randomized trials. And Dennis, you would not be surprised to learn the Biden administration spent $1 billion on long COVID, not a single new drug or protocol. So I've taken matters into my own hand, myself and Dr. Proctor and my team. We've published McCullough Protocol, BSD, and you know what? It's becoming a worldwide standard.
So petermcculloughmd.com, they could go and find and read up more and get all the dosages. Like you were saying, they could find all of that. It doesn't cost them $1. They could go in. Now, for something of that nature, somebody who took that shot a year and a half ago, do they have to go through this, or is this somebody who's just had it in the last 6 months?
The key thing, what the key thing is, Dennis, and I have some pieces coming out. It depends if they had a sore arm or not. If someone took the shot and they never had a sore arm, the published data, my observations are they never will have a problem. So fortunately, my mother-in-law took 2 shots. She's nearly 90, never had a sore arm. She's perfectly fine. But people who have had a sore arm now, in a paper by Nakahara and colleagues, they tend to actually have abnormal cardiac PET scans, almost all of them. Schwab and colleagues have shown inflammation in the arm directly correlates with inflammation in the heart and heart damage. So I asked people if they had a sore arm. Anybody who took a shot with a sore arm or other symptoms, yeah, I think they should undergo detoxification. We are seeing cardiac arrests and blood clots now 2 years after taking the shots in 2021 with people who had initial symptoms.
So regardless of when you took it, if you took it and you had a sore arm, you're saying go visit petermcculloughmd.com. Now, I can tell you, Doc, just from history, there is somebody listening to this right now who had it 2 years ago. They can't remember if their arm was really sore or kind of sore. I think it was sore. and they're just going to say, I should do it anyway. Is there any risk of somebody using what it is that you're listing there if they didn't have a sore arm, but they just want to kind of check the box and sleep a little easier?
Yeah, people want to sleep a little easier. They should know that these are over-the-counter supplements. They can be bought at any vitamin store or Amazon. The wellness company makes, I think, the highest quality nattokinase is called Spike Support. They actually make kids Spike Support, which is another formulation for children. And, they're over the counter. They have, a very, very good safety profile. They're low dose. The Japanese, by the way, use nattokinase as a cardiovascular prevention supplement. So, I mean, the people are taking natto in Japan for other reasons as well. So I think people can feel good about this. They can rest assured. We don't know how long this should be done. We are saying at least a minimum of 3 months, to try to cover the bases there. We shortly, by the way, Dennis, will have a blood test to measure the spike protein. That's going to be very useful. A company called Invitrogen, competing company from Japan, will have these blood tests we can order through LabCorp request. Right now, we're measuring the extended range antibody against the spike. And to give you an idea, someone like you or me, I didn't take the shot either. It's never safe enough for me. We had COVID. So if we measured our antibodies against the spike, the number would come back at 400, 500, 600, something like that. If you've taken the shot, the number is like 20,000, 25,000, because it's so much more spike protein by having it directly injected in your arm.
Wow. 2 questions for you, and then I'll let you get back to being a doctor.
Thank you.
So you were talking about the states. You believe that the states should take this into their own hands. Has Ron DeSantis in the state of Florida heard this suggestion from you? Because I would think he would be first in line.
He's definitely hearing it from Joe Ladapo, his Surgeon General. Joe is in my circles. Joe's made public statements that the vaccines aren't safe for use. Joe initially, like I did, I've been on Fox News dozens of times on national TV. I've told America these aren't safe, certainly not for children. And then we've learned in adults more and more side effects. So he's hearing it from Joe Ladapo, and we're hoping one of the states will pull the trigger. I know several jurisdictions in Florida, several towns have actually declared that the vaccines are dangerous. The same thing is going on in Idaho. I've sat in on some of those sessions. The U.S. House of Representatives is about ready to launch a whole series of hearings on this. For the first time, by the way, the House of Representatives have still not heard from a treating doctor. They've brought in some TV doctors that have never seen a COVID patient or a vaccine blood clot. But I've encouraged them, listen, bring in some real doctors who have seen this. The Senate has done that. So we can tell America firsthand what we're seeing. My clinic is like a war zone. You know about the worries of people with, needing heart pacemakers and atrial fibrillation, heart failure. All those things are worsened by the vaccines. So we've seen people actually take a vaccine, get heart damage, and need a pacemaker or defibrillator, or need a heart transplant. I have a man who, he previously had a bypass surgery, previously had a defibrillator, took 1 shot of Moderna. Within 8 hours, he's in fulminant heart failure, and he required a heart transplant at Emory University. This was written up and published in Trial Site News. And then, the guy finally recovers. He had a stroke and infections. It's just ruined his life. This guy's a high-level business consultant. And then Emory wanted him to take the second shot, Dennis.
Oh, what is wrong with these people? What is wrong with these people? When you say something like that, it leads me to my last question here, because people like that should be held accountable. I mean, that's as far as I'm concerned, that's malpractice. So do you think Anthony Fauci will ever be held accountable for what he's done? Do you think he's ever going to be held accountable, or is he just going to wind up skating through?
The fact pattern is there. We'll have to see how the tide turns in terms of investigation. It's going all over the world, by the way. But I testified and visited in the Parliament in Australia. I recently visited the Upper House in the UK, and of course the European Parliament. You know what I learned? All over the world, these governments, they relied on the US FDA.
Really?
And when I asked the Australians, I said, didn't you do your own review? They said, no, we relied on the FDA. So the FDA and the CDC are working together as the vaccine sponsors. The National Institutes of Health has largely been the vaccine research unit. So Fauci has had a tremendous influence over that triad, NIH, CDC, and FDA. Multiple books written with the fact pattern in it. Peter Bregan's COVID-19, the Global Predators, Robert F. Kennedy, the real Anthony Fauci, and now recently Rand Paul's book. I just tweeted this out, that here's a guy getting an ethics award. And, there are multiple high-level sources saying it's just the opposite. He should be behind bars.
Dr. Peter McCullough, 2 places you could go if you had the jab and you want to get yourself detoxified. Go to petermcculloughmd.com. And if you want to give to this good man, if you want to try to help him help you, go to mcculloughfnd.org. I just did it yesterday, and I gave him a pretty healthy donation. Ask you to do the same. If we didn't have people like him, we would be in a lot of trouble. Not to say we're not in trouble already, but think about it would be if we didn't have him. Dr. Peter McCullough, you always take your time out. You're a gentleman, and I appreciate you, and I appreciate your time. And I want to say thanks until I see you again.
Okay. Thanks so much.
See you soon.